Hey, Jake Thompson here, corrective exercise specialist with Axis Training Studio. And I'm here with Kate, who is a licensed physical therapist, and she is basically the guru when it comes to vestibular dysfunctions. And lately I've been getting a ton of questions regarding IT band syndrome, and so I figured I would bring in the expert to kind of give you more information about IT band syndrome, what it is, what causes it, and things of that nature. So basically, Kate, what is IT band syndrome and what are the signs of it?
Okay, IT band syndrome is a syndrome that can actually flare up at the knee joint or at the hip joint. And this is where something called your IT band, which is a long tendon that runs from the top of the hip and attaches at the knee, is too tight. Symptoms mostly present as pain. A lot of people will notice difficulty going up or down stairs, or running or biking mechanics can be greatly altered because of IT band syndrome. One of the things that occurs, if you think of the IT band as a band that runs down the outside of the leg, is it can actually cause friction at the hip joint, specifically at the subtrochanteric bursa, or at the knee joint on the lateral or outside of the knee.
Sure. Now, what are the common causes of IT band syndrome?
The primary cause of IT band syndrome is muscle imbalance, specifically of the glutes. So the glute max, or the tush muscles, or the glute medius, which is the outside of the hip.
Okay. Now, this is something that I've noticed. Why are women more susceptible to IT band syndrome than males?
There's something called the Q angle, and that's the angle that goes from the anterior part of the hip to the middle of the kneecap. Women, because we have wider hips, have an increased Q angle. Women are also more likely to pronate their feet or roll in to their arches on the inside of their arch. This increase in Q angle actually puts excess stress on that IT band along the outside of the leg.
Sure. Makes total sense. So how can people prevent this problem, and what steps can they take if they're already experiencing symptoms of IT band syndrome?
If someone's already experiencing symptoms of IT band syndrome, either in their training program, daily life, again, walking up or down stairs, there are many causes. And so the best thing to do is understand what is causing that particular problem. It can be from structural abnormalities, generalized tightness in and around the hip or knee joints, again, weakness around the glutes or hamstrings, or it can actually be the way in which you're training. So if you're doing a lot of hill training with running, some simple modifications can actually be made to alter the frequency and intensity in which you're training to still get the same results, but in a pain-free way. So the first thing is evaluation. The second thing a person can do is RICE.
Sure.
Rest, ice, compression, elevation. So, notice what are the exacerbating causes of the symptoms.
Sure. So there you have it from the leading expert as far as IT band syndrome causes and what you can do. So my recommendation is to seek out a competent physiotherapist such as Kate, who can actually do a comprehensive evaluation to look at your unique situation and then give you a program to kind of overcome your injuries or even prevent your injuries.